Hi everyone, so today I'll be doing a mesio-angular 4/8, a full surgical. Now, usually with the mesio-angulars, they're a bit easier if the roots are separate because the section is a lot easier. It separates into two separate halves and comes out. But this is the section I'll be using now that the roots are fused. The key things about this section is it's really important that the mesial part of that is thinner than the portion at the top so that it can come out. Now, this is an example of an incorrect section, and the reason for that is because the width at the bottom part of that section is actually bigger than the width at the top. So when you go to try to deliver this, it becomes quite difficult. And this is one of the most common mistakes I see people who are fairly inexperienced at this. It's one of the most common mistakes I see them make. So I've skipped the flapping just to save a bit of time in the video, but it's my usual envelope flap, distal relieving incision, nothing on the mesial. When I'm sectioning, I'm basically using a NSK 45 degree high-speed surgical handpiece, and we're using a fairly large diamond burr there. The total width of the section is greater than 1mm. Starting on the buckle, because that's where it's easiest to see, and moving the handpiece across so that the whole tooth gets sectioned, leaving only a slither of tooth on the lingual portion. Now I'm trying to stick as much as I can to the angle that I anticipated. Basically, as I said, the key mistake, or the biggest mistake people make here, is not sectioning at that angle, so it makes the disimpaction of this mesial portion a lot more difficult. The other thing that people don't do is go far enough to the lingual, so when they go to disimpact the crown, they chip off the mesio buccal, but the mesiolingual portion remains and stays impacted. Now you can see what I do there. Because I've left that slither of bone, I just use the luxator to snap off that mesial portion, and because I've used a pretty good angle, it comes out fairly straightforward, that mesial portion. So once I get rid of the mesial portion, I go straight into the luxating the root complex out, and because there's nothing impacting it, and because the age of this patient, I think he was only about 23 years old, it's a fairly straightforward elevation. Yeah, as you can see, it comes out fairly straightforward there with the luxator. The whole thing in the chair took me about 5-6 minutes. It's reasonably predictable when you've planned it well, and just a simple stitch. Because I've got a fairly conservative flap, and I don't really necessarily recommend this unless you've got a little bit of experience. Visualization is important, but because it's such a conservative flap, a single stitch brings the tissue together fairly well. And I'm using 3/0 gut. So yeah, as you can see, it comes together fairly well there. I'm not sure what my DA is doing with the mirror there, actually. And there we go. So you can see the angle of the section, kind of exactly what I predicted.